sexual side, that's been a long, hard struggle. Sorry about the pun, but it's been a long, hard struggle. It took a long time for me to feel any urges again, and certainly spent numerous conversations with my wife in terms of how she felt and how we felt together as a relationship. Probably grew a little differently, and we still have difficulty.
Erectile function, this is the time of erectile dysfunction for all the boomers, and thanks to you boomers, there are plenty of options for handling that. So I used some of those options and they worked out well.
My sexual performance, I have to admit, has been definitely affected, although I think things are coming back to life that way, and I was told it takes time, and I have hopes and expectations that that will happen, but how did we deal with it? With understanding. It's like communication and just making sure that that my wife understood the impact that was probably going to happen, and it did happen, and she's been very understanding, and we, like I say, we hope that in the near future things are going to start to get back to more of a normal type functionality.
The biggest part of all that was my wife and how she had to deal with the symptoms and the side effects along with me, because I felt badly that I couldn't do what I needed to do for her, but I have other tricks up my sleeve that I could use to keep that part of our relationship whole. But that was probably the hardest part, not being able to be aroused on demand. Right? I needed assistance, and I felt vulnerable for the first time. Other than being under the knife, that was probably where I felt the weakest as a man.
Brachytherapy did not leave me with incontinence, but what it did leave me with, though, was erectile dysfunction. That has been very frustrating because I've always been a somewhat sexually active man, and to have that virtually sort of taken away from me in just virtually one procedure is not very nice. And then how do I deal with this? How do I, tell a partner that this is what might or might not happen? So I actually find that actually very, very frustrating. I
was probably not prepared for the sexual side of it. I didn't realize that the radical prostatectomy would in fact slightly reduce the length of my penis, as it does. And that was a little bit of a surprise. And as I say, it's taken some considerable time to work ourselves up back again into our relationship the way that we want it.
Erections are not easy to come by anymore. No, I'm going to hopefully have that corrected. I've taken Viagra, Cialis. Sometimes that works, sometimes it doesn't. So I do believe that masculinity has a great deal to do with our sexual prowess, and also and that confidence that goes with that. When that dies or when that goes, that prowess or that sense of maleness and that sense of masculinity also goes with it.
In discussions with my wife, and in times that we were not able to have sex in the normal way, it required some conversation. So we were not able to have normal sex for several years, and we had to find other ways of doing it, other ways of being close, other ways of maintaining the closeness that a married couple should have. And there are other ways of doing that. I don't mean other ways of having sex, but other ways of filling that void, if you like, and doing it in a way that is successful for both of you. And I think it opened up a dialogue with her that I had never had before, never had to have before, because everything was fine. I didn't have any erectile dysfunction whatsoever.
It hasn't impacted my perception of myself as a man. Yes, certain things have changed in terms of my manhood, if you will, but that wasn't ever my primary focus in life, and it certainly wasn't my primary focus as part of the treatment regime. In fact, when the surgeon asked me what I wanted, I said, I want you to get rid of the cancer. I would prefer not to be incontinent, and as far as impotence or erectile dysfunction goes, I've had a pretty good life up until now, and if that's a problem, then I'm sure between mechanical issues or chemistry, we can overcome that problem.
And that did affect my brain for a while, but we've rebuilt that. We're now having regular relations, and we are enjoying sex again, and our marriage is very strong. And I'd say, is it stronger than it was before? In some ways, I think it is. And now that I think about it, because we're more open with each other, we're very confident about talking about our sexual issues with each other, and obviously women as they age go through their own changes. So she's been going through the change herself, and we are mature adults now in our late 50s, and we've had to make a number of readjustments, but we're still very much together.
Whatever happens, remember to put one foot in front of the other and keep moving forward.
I think I am probably the perfect example of a guy who didn't want any of these treatments. I went through all of them, and here I am, and I feel fine, and my life is good, and just do it, because living is better than dying.